Good afternoon and welcome to our webinar on lower back pain, how to help yourself and how to help your symptoms. Thank you for joining us. I'd just like to start off by pointing it out towards our feedback survey right at the beginning, I know, but if you do have to leave halfway through, it'd be great to get your feedback on how your experience has gone today and if we were to run it again in the future, what we can do to improve. Second thing I'd like to make you aware of is the question and answer function. So if you have any questions you'd like to raise during the event, then feel free to type away and post your questions in there. They can be raised anonymously as well, so if you want to hide your name, that's fine. And we will, there's an option to vote up each question, so to give them a thumbs up. And at the end, we will go through the questions in the order of how many thumbs up each question has got. So without further ado, I will introduce to you our clinical specialist, Rebecca Milton, who will go through the presentation with you today. So over to Rebecca.
Thanks, Claire. Welcome everybody, like Claire said, to our webinar on low back pain. The idea behind this is that we're hoping it will provide a bit more of an understanding around low back pain, its prevalence, what causes it, and ultimately how we can help manage back pain at its best. So what we're going to go through and cover, so we're going to talk a little bit around low back pain, what it is, what the general sort of healing timescales are that we would expect for someone to recover with low back pain, any contributing factors that can cause low back pain, the impact of low back pain, some of the common myths and misconceptions around low back pain, and then ultimately, most importantly, what can you do to help in the management options around low back pain. So low back pain is really, really common, so you are absolutely not alone if you suffer with it. About 1 in 6 people in the UK suffer with low back pain at some point in their life. So rest assured, it is really, really common, and you are definitely not alone. It is most commonly caused by a sudden change in your activity levels, whether this be you used to live a bit of a sedentary lifestyle and you've suddenly increased your activity level, or the opposite way around, whether you've gone from being quite active to less active. They're the most common causes of back pain when there's a significant change in your activity level. Sometimes low back pain can announce itself and come on without any seemingly good reason. And as frustrating as that might seem, it does happen, but less obvious triggers can include things like sleeping in a funny position for a bit too long, and obviously those are things that are a little bit outside of our control, but those things can also trigger back pain. So low back pain is pain that we would describe being localized to the lower region of your back. So this may be in the middle, this may be one side, or it may be all the way across your lower back. So this diagram, you can see the general area where we would expect low back pain to present itself. Normally, this is caused by muscles or joints in the affected area. So this can be things like muscle tightness or muscle weakness, which can cause structures like your joints to become inflamed, irritated, or sometimes joint stiffness, which can all contribute to causing low back pain. When you suffer with low back pain of this description, pain is normally described as more of an ache with some occasional sharp pains dependent on some activities and bits and pieces. The reassuring thing that we should take away from low back pain is that actually it can spontaneously resolve, and we will talk a little bit more in a moment about what sort of timescales we would expect for back pain to improve. But that is what we would generally classify as your low back pain that is that 1 in 6 people suffer with. And my next slide, now we're going to go and talk a little bit around sciatica, which is another condition that people really commonly suffer with. So sciatica is a very broad term which encompasses people that have low back pain and associated leg pain. So the leg pain is normally nerve pain, and it normally only affects one leg at a time. On some occasions it can affect both legs, but it's much more common just to affect one leg. This leg pain, like I say, is that nerve that becomes irritated. There's a lot of misconceptions around nerves being trapped in the lower back, and it's very often not the case. So on most frequently, nerves are more likely to be inflamed as in and around your lower back area, and as it originates from your lower back and it supplies different areas of your leg. Most commonly people report sciatica down the back of their leg, but it can also affect the outside of your leg or the front of your leg. You may also experience some symptoms like pins and needles and numbness, which are very, very common with people in people who suffer with nerve pain. This again can spontaneously resolve. Sometimes it takes a little bit longer. Nerves can be a little bit more stubborn to heal than just muscles or joint pain, but it can spontaneously resolve. And we will talk a little bit more now about what kind of healing timescales we would expect for people presenting with both low back pain and also sciatica as well. So this is, generally speaking, most back pain will start to feel better within a couple of weeks. So you'll start to feel a lot more comfortable, and maybe more comfortable doing basic movements, and you might be sleeping a little bit better at this point. By 6 weeks, most back pain is notably improved. So you will notice that you'll likely be back to doing most of your normal activities of daily living. Your pain is calming down. It's definitely not as intense as that pain might have been at the beginning. And generally by 3 months, symptoms of back pain and sciatica will be almost fully resolved. So at this point, you'll be back to doing pretty much everything. You might get a little bit of pain every now and then, but it's generally not having a huge impact on your daily life at this point. Sometimes, though, there are exceptions to the rule, and people do still experience some symptoms after 3 months, and you're not alone if this is the case. Sometimes what happens is the initial injury that will have occurred will definitely have healed by this point. But there is still pain sometimes because our body's pain system, which is like our warning system, struggles to switch off again. And this is where hopefully this webinar will help with how to manage this and manage and your treatment options for if you are still experiencing pain and how to help it. So before we go on and talk about the management bits and pieces, there is just one other condition that I want to touch on. So this condition is a condition called cauda equina. Now this is a very, very rare condition, but it is a condition that requires immediate medical attention. Now this isn't, I'm not telling you this to scare you or to worry you. It is very rare, but it's something to be aware of just in case. And it's so rare that only 1% of the population with lower back pain will develop this condition. And it's a condition where your spinal cord is affected. And like I say, requires immediate medical attention. So by that, I mean immediate medical attention is 111 or 999. And if you're unable to contact anyone and speak to them immediately, it is taking yourself to A&E. So signs and symptoms to be aware of include having leg pain, like we spoke about, like a potential sciatic pain, alongside any bladder problems, so bladder retention or incontinence. Now, retention means when you're unable to empty your bladder, or incontinence where you're unable to control it. Likewise with your bowel, so bowel incontinence is a sign and symptom of cauda equina, as is numbness around your genitalia and loss of sexual function or sensation. Now, if anyone is worried about these signs and symptoms or feel that they want to know any more information around this, then in our chat function, there is a link to further information regarding cauda equina. So now they're the main conditions that we've covered. We're going to go on and talk about some factors that we think that can cause or predispose people to low back pain. So inactivity is a big part. Okay, being inactive and leading a sedentary lifestyle can lead to deconditioning of your muscles, which as a result can predispose you to aches and pains, as our bodies normally are designed to be used, moved, and put through their paces a little bit. And if they're not done, if that doesn't happen, then we become deconditioned, and then our body is much more sensitive to when we do move. So it's just being mindful that if a lot of us do have desk-based jobs, it's just remembering to take regular breaks, and where you do have time to go out for a walk or do bits and pieces, then just trying to maintain some level of activity. So weight is also a big factor that can cause low back pain. As with any joint or any condition, and this isn't just isolated to our lower backs, the more weight we carry, the more stress and strain that is placed upon our body, which again can predispose you to low back pain, knee pain, lots and lots of different things, but it is definitely a well-known causative factor of low back pain. Smoking is also something that can not necessarily predispose you to low back pain, but it can definitely slow down your healing from if you suffer with an injury. So if you're a smoker, smoking slows down our body's natural healing process, making it more difficult and taking longer to heal and recover from bouts of pain. So it's just bearing in mind, we know that smoking can also come with lots of negative effects. It's just bearing in mind that it also does slow down our healing. Previous injury can also lead to low back pain. So this doesn't necessarily mean previous injury of your lower back. It can be a previous injury of your arm, your leg, wherever. But if you have a period of inactivity, again, this leads to some deconditioning, and then when we start reintroducing things or doing certain movements and activities, then again, if we're not strong enough to cope with doing that, then that's when sometimes when we can get some aches and pains around our lower back. Stress is also a huge contributing factor to pain. So we don't have one body for mental health and one body for physical health. They're very much, one body for all of it. So stress and worry and things like that can play a big part in influencing our pain. So if those are things that you feel like you're struggling with, then it's definitely worth speaking to your GP about these things, because actually getting on top of stress, worry, things like that can really help recovery from any pain, not just low back pain. And finally, poor sleep. So poor sleep is a very important factor in our recovery. So our sleeping time is really important, as it is our body's time to heal and recover. So if we don't get good quality sleep, then this can again influence our pain and the healing process. So as much as you can, having a really consistent sleeping routine is really important to, one, help recover from back pain, but also to prevent, injuries, not just of your lower back, of anything occurring, because actually our body needs time to rest and recuperate as well. So we're now going to go on and talk about a few back pain myths, okay, and some misconceptions around low back pain. So one of the common things, especially in our role as physios, that we see a lot of is are these common myths. So that discs slip, that an MRI will tell me what's wrong, bending being dangerous, heavy lifting is dangerous, and that bad posture causes back pain. So I just want to go through these a little bit more, because hopefully I want to reassure you all that we don't need to be scared of our backs. They're so strong. They are one of the strongest structures in our body, and they are really resilient to movement. Okay, so If we firstly touch on my kind of the preconception that discs can slip, I can reassure you that discs do not slip. They are very, very firmly in place. In fact, like I say, our spine is one of the strongest structures in our body. Discs can slightly bulge, so that is a terminology that is accurate, absolutely, but they will not slip, okay? And again, talking about a disc bulge doesn't often cause pain. Disc bulges are very, very common and quite often do not lead to pain, are not the cause of people's back pain. So this kind of comes hand in hand with the point below where an MRI will tell me what's wrong. Quite often an MRI really won't provide much helpful information. It will tell us that all those important structures in our back are absolutely fine, but because they very, very rarely go wrong. So it's very normal to have certain findings on an MRI which probably won't cause you pain. So for disc bulges, for example, and I've just got on my next slide a little graph to illustrate this quite nicely. So this graph was done from a huge research study that they did, where they MRI'd about over 3,000 patients that had no back pain. And these are the most common findings on the scans of these people that had no back pain. So if we look a little bit more into this, we can see that at the age of 50, people around the age of 50, about 60% of them had a disc bulge on their MRI, but again, had no pain. And the same as, let's say, people around the age of 60, 70% of them had a disc bulge on their MRI, but again, had no pain. So it's just being mindful that things like disc bulges are very, very common on MRIs and not always the source of your pain. And likewise, the terminology degeneration kind of gets thrown around a lot and sounds really scary, and it's really not. So when people say disc degeneration or you've got degenerative change, it's just a really fancy word for saying normal age-related changes. So it's like getting wrinkles but on the inside, and we know that wrinkles don't cause us pain. So, you know, at age 60 here, we can see that almost 90% of these 3,000 patients showed some degenerative change on their MRI, but yet had no pain. So the importance of this that I wanted to emphasize is that sometimes MRIs find things that will not be the cause of your pain. So it's really important that if at any point you do have an MRI scan, then it's important to have someone go through your results with you to understand them fully. So we can make that decision as to whether we think that those findings are related to your pain or not. Because we have to be mindful that MRIs don't show pain, they don't show muscle tightness, they don't show weakness, they only show those really, really important nerve structures in your spine. So back to the rest of the preconceptions. So coming back onto bending being dangerous and heavy lifting being dangerous, they kind of come under the same umbrella, both of those. And rest assured, they are really not dangerous. Our body is designed to be moved and used. And if we avoid doing something, so if we had an instance where bending did trigger our back pain, we naturally will want to avoid it because you know, that memory of doing it caused pain. But if we avoid it, our body will become deconditioned to doing that activity, which is why then later on down the line, bending or lifting might cause pain because our body is so out of practice of doing that. So it's really important that we keep doing these activities because although back pain is common, it's not always as a result of bending and lifting, and it's really important that we keep doing these to keep our back nice and mobile and nice and strong. And finally, talking about posture. So there is absolutely no research or no evidence behind to suggest that posture is linked to back pain. Your posture will have been the same for years and years. Therefore, it's unlikely to suddenly cause you pain. And on the other side of that, if we suddenly try to change our posture and our body's natural position, then we risk causing pain because you're asking your body to do something that it hasn't done before. So ultimately, you should, if you have back pain or you want to prevent back pain, you should sit, stand, sleep in whatever position is comfortable for you. There isn't a right or wrong in regards to posture and back pain. So I hope that clears a few things up around these kind of myths that we as physios, and I think GPs do as well, see a lot of this. So I hope that makes a little bit of sense. So I'm just now going to go on to talk a little bit about the impact around low back pain. So we understand the impact low back pain can cause physically, but it's also very important and completely normal to experience some less physical effects from your low back pain. So these can be things like low mood, anxiety, depression, equally frustration and anger that you're suffering from this pain and that it's potentially stopping you from doing things that you want to be able to do. It might result in a loss of independence if you don't feel that you're able to drive or walk or do certain activities again. And again, it might affect relationships. So if you suffer with these things, you're not alone and they are very, very common. So please don't be afraid if these are things that you are suffering with to seek help from your GP regarding these issues, because it is equally important to address the physical and non-physical effects that low back pain can cause. So we're going to go and talk a bit more now about the management and what we can do with the majority of the physical effects, but don't negate and don't put the kind of maybe the less physical effects on the back burner at all. So what can you do? Well, lots of things, and these are just a few and probably the most important ones. So it is really, really important when you suffer with back pain to keep moving. Now, I appreciate it might not seem the most logical and the easiest thing to do, but it is the best and the most important thing you can do. Like I've touched on multiple times already, not moving will cause deconditioning and make it even harder to then get going again. So like I've said again, our bodies are designed to be moved and used. So the quicker we get back to doing these things, the better. So I know probably a question leading on from that is, okay, so how do I go about keeping moving? What sort of things can I do to get moving again? So some gentle lower back exercises will play a big part in your recovery, and my next couple of slides following this will show you some exercises that you can do to try and help your back pain initially. Pacing and modifying activity. So this is a really important part of managing pain. And again, this isn't just related to low back pain, but what pacing means is breaking down certain activities, certain jobs into little bite-sized chunks and doing things little and often throughout the day or throughout the week, not doing it all in one go, because our body, when we are recovering from pain or an injury, does need a little bit of time to recover as well. So let's say you've got a whole lot of gardening that needs to be done. It's going out and doing maybe 10 minutes, having a breather, make yourself a cup of tea or whatever, and then going back out and doing a little bit more. It's managing those tasks into smaller bite-sized, more manageable chunks that you can do. Healthy eating and weight loss. So poor diet and excessive levels of fat contribute towards higher levels of inflammation. So again, if you've got a poor diet, then and there's quite a high fat content, then it's potentially just going to be another source to slow down our recovery and hinder getting back to where you want to be. So just bear that in mind alongside what we spoke about with that an increase in weight can cause what can predispose us to back pain as well. Heat and ice. So these are really quick, easy things that you can do to help your back pain. So heat and ice may provide some temporary relief in order to get you moving and getting back to doing your activities. So again, there isn't a right or wrong. It's whichever you feel helps you as opposed to anything else. And it's not necessarily going to be the be all and end all, but it will, hopefully, the idea of these things is to give you that period of relief where you can get up and move, because we know ultimately that's what's going to get you back to where you need to be. Sleeping position. So again, I touched on this a little bit when we spoke about posture, but there is no right or wrong when it comes to sleeping position. Ultimately, whatever position is comfortable for you is best. Things that may help if you haven't tried and you are suffering is most people find that lying on their side is more comfortable when they do have back pain. So lying on the side and potentially a pillow between your legs, just to keep you as supported as you can, and you might find that helps when you're trying to get comfy in bed. Or if you are someone that prefers lying on their back, then equally a pillow under your legs, just to try and give you as much comfort as we possibly can, because like I said, getting a good night's sleep will really, really help recovery. So sitting position again is really important, but the most important part of this is to avoid sitting for too long, and by too long I mean kind of aiming for maybe no longer than half an hour. And I appreciate if people have desk-based jobs and that might seem like an impossible task, but even just every half an hour, standing up, marching on the spot for a minute, trying to move every half an hour for even a minute will help your back pain or prevent any causes of back pain. When you are sitting, if you feel uncomfortable when you're sitting, having a cushion behind your back or a rolled up towel might help your pain. And finally, painkillers. Now, I know that I'm the same as well as lots of patients, that everyone's a little bit reluctant to take painkillers, and we appreciate that, but painkillers, it doesn't mean that this is going to be a long-term thing and that you're going to be on pain relief forever. It is used in this instance as a temporary measure in order to help get your pain under control. And when your pain is under control, it will then facilitate you and allow you to get up, get moving, and hopefully bridge that gap between you being in pain and getting back to your normal activity. And once you are back to doing your normal sort of activities, then again you can reassess whether those painkillers are needed. But the advice that we give you would be to speak to your GP around what painkillers are appropriate if it's something that you feel that you would want to discuss. So, like I said at the beginning, the next couple of slides are going to be a few exercise demonstrations. Okay, so these exercises are some examples of basic lower back exercises to help you get moving initially. So these should play. So you can see here that all I'm doing is nice and slowly taking my knees side to side, and these should be, when you're doing them, they shouldn't be exercises that cause you a huge amount of pain. A little bit of discomfort is absolutely okay, and you're not going to do any harm by working into a little bit of pain, and you just go as far as you feel you're able to with these exercises. Likewise with this next one, just hugging the knee to the chest. Again, you don't have to go as far as I am on that. You can go as far as your pain feels that pain allows you to. Okay, there are then progressions from these which we'll go through after, but there are a couple of examples of what you can do initially. Likewise with the next ones. So here you can see just on my hands and knees, raising back up and then lowering back down. And then the next one, nice and slowly, just lifting bottom up and down off the bed or off the floor, okay? And like I said with this previous exercises, the same principles, okay, apply in the respect that we don't want you to be pushing into lots of pain when doing these. We want them to be relatively pain-free. So you just go as far into the movement as you feel you can. These exercises will then hopefully soon become easy. And as they do, it's then important to start increasing your activity levels further. So this might be doing some higher level rehabilitation exercises, which I'll show you on the next slide, or it might be something like returning to some light walking, doing some swimming, Pilates, gardening, whatever hobbies, activities that you like to do. It's getting back to doing those at that point. So one of the important things I want to emphasize is that these exercises are completely safe for you to do, okay, when recovering from your back pain. So don't worry that they're going to cause any harm or anything like that, okay? So a few progressions then. These, unfortunately, I don't have some nice videos of these ones, but these are some examples of what you can do to progress them. So on your hands and knees from the position that I was in, lifting that leg back up. So these are exercises that will now start to help strengthen around your lower back, your hips, your legs, okay, all of which is really important when suffering with low back pain. So lifting leg out at the back for the second one. The one on the top right hand side, again, this doesn't have to be done with a weight, but slowly lowering down with the weight and coming back up. Bottom left, lying on your side, lifting the leg up, okay, nice and slowly. The same with the other two as well, some gentle squats and lunges. Now again, it's important that you feel that you're able to do these with minimal pain and discomfort, okay, and these are really good exercises that you can do to start strengthening around that area. So I'm just going to touch on exercise a little bit more because exercise is really important in our general health and well-being, but also preventing any back pain or any other injuries as well. So the national guidelines state that exercise, we should achieve about 150 minutes of moderate intensity exercise a week. Now that sounds like a lot, okay, but you can break that down into much more manageable chunks. So that's 30 minutes over for 5 days a week, okay, which sounds a little bit more manageable. And those exercise minutes should be a bit of a combination of things. So some of it should be potentially some stretches and mobility exercises, like the bits I've shown you before, some strengthening exercises, and also some cardiovascular exercise, which is any exercise that you feel increases your heart rate. So walking may be a good example of that. Swimming might be a good example, as will cycling. Okay, so that's the guidelines around exercise, and the more that we can meet it, the better our chance of preventing back pain or managing our back pain is going to be achieved. So if you have tried all those bits and pieces and you still feel like you're suffering from your back pain, this is what we're going to talk about next. So what if it isn't improving? What else? What are my other options? So at this point, it might be that a referral through to physiotherapy is appropriate. And I will talk a little bit more around physiotherapy in a moment. The doctors may also consider a referral through to pain management. So pain management, we have a couple of specialists. We have a specialist pain management service around East Berkshire, which they're a very, very highly skilled team of pain consultants, specialist pain physiotherapists and psychologists who are have a really high skill set and train specially in pain management to help discuss how to manage your pain a bit more effectively. And there is also the chance to be referred through to our orthopaedic team, who are our spinal consultants, and we will touch a little bit more on what they can do in regards to injections and surgery. But these are not things that are offered out lightly due to the risks and bits and pieces, and we'll go into that in a moment. So physiotherapy, as part of the physiotherapy team, okay, I can give you a really nice insight into what we can provide for you. So we'll provide an individualised assessment and treatment approach that is completely tailored to your individual symptoms. And as a result of that, we'll make an action plan of how we can help get you back to where you want to be. So we will go through lots of questions with you to establish what your goals are and potentially how we can put a plan together, whether that's some exercises, some rehabilitation bits and pieces for you, or some group exercise classes to help you get to where you want to be. Okay. Our physios can also provide lots of advice and education around things that I've touched on today, but potentially going into a bit more detail in your individual cases. Other treatment options are things that we can offer manual therapy if we feel appropriate, and this is all decided on about a case-by-case basis. And acupuncture is something that's been that we hear quite a lot of mentioned quite frequently as a method for managing back pain, but it's not recommended for low back pain. So it's just something to be mindful of. In regards to physiotherapy and the evidence and all the research that's been done behind it, the gold standard approach for treating back pain is a personalised exercise plan in conjunction with anything else, advice, manual therapy that we feel when we feel appropriate. But exercise has been shown to be the most effective way of managing someone's back pain. So that's physio. We will then go on to talk about orthopedics and injections. So you may well hear these kind of terms thrown around a little bit. So the two injections that they would offer you would either be a steroid injection or an epidural. Now, these will only be offered for certain conditions. Injections are only indicated for people who suffer with back and leg pain. They will not be offered to anybody that suffer with just back pain. Okay, this is where injections are designed to help the leg pain as opposed to back pain. The aim of the injections is to improve local inflammation and pain, and therefore to allow a window of opportunity to improve your activity level and participate with your exercises or your normal activities, or make the physiotherapy more effective if you are being referred to physio as well. They're not necessarily a fix. Okay, the benefit normally can be anywhere between 6 to 12 weeks, which is why in that period of less pain, it's really important to get moving, get fit, get strong, all of those bits and pieces we've touched on to try and limit the reoccurrence of this. It doesn't come without its risks, these injections, as does surgery, and we will come on to those risks shortly. So surgery should be a last option. If you have been to a spinal consultant in the past, or you're wondering about surgery, consultants are actually really reluctant to do surgery, and they will only do surgery once all other conservative methods have been trialled. So you managing it on your own, some pain relief, physiotherapy and injections. Okay, if all of that has not provided you with any relief and you are a patient that is a candidate for surgery, so again, surgery is designed to help leg pain, it's not designed to help back pain. So if the consultant thinks you are an appropriate candidate, then that's when it will be discussed on a case-by-case basis. But please be aware that approximately 20 to 40% of spinal surgery is unsuccessful, which is why everybody, so all healthcare professionals, would try and really convince you and hopefully work with you to trial all of the other conservative methods before considering surgery. Okay, because like I said before, it does come with its risks. So the risks are infection, which is about 4% of spinal surgery cases, blood clots, and blood clots are really quite frequent, and if you're somebody that is slightly overweight, smokes, has a sedentary lifestyle, they are risk factors for developing a blood clot. So your chance of having one of those is higher if you fit into any of those categories. Wound healing, again, it's not always smooth sailing, unfortunately, but the healing of the wound can take time. And again, if you're overweight, you smoke, you have diabetes or any other pre-existing health conditions, then again, that might affect the chances of your wound healing. So just being mindful around that. It can cause damage to the nerves, and that can be permanent. So that could be paralysis. Okay. As we know, there's lots of important structures around our spine, so the risk of damage to the nerves or paralysis is something that we have to be mindful of. Okay, and ultimately there is a chance of mortality. About 1 in 700 cases result in mortality, which is a little bit scary. So it's just being mindful of those risks, okay, when considering any injections or surgery, because all other options should be exhausted first. So hopefully that's provided you with a little bit of advice, education, a bit more of an awareness around back pain and what you can do to help back pain. And if you have any questions, then now is the chance to ask them.
Thank you, Becca. Now we do have a few questions. Have you got your next slide with some of the links up if people want to access any more information? And I think that one of our moderators is also going to publish the links if people are interested in more information. But we'll go with the questions that we have got the most thumbs up first. So first question is, how do I know if I need an MRI or an X-ray?
So it very much depends on a case-by-case basis. So more often than not, an X-ray is not indicated. So an X-ray will provide us with very, very little use. It will only show our bones, and quite often our bones are absolutely fine and not the cause of our pain. An MRI is only indicated in specific pathologies. So in more cases than not, people that suffer with back and leg pain would be more of a candidate for an MRI. However, having said that, those that slide that I discussed, that actually an MRI quite often doesn't show us the cause of our pain, and more often than not, it's not going to change your management. So it's only indicated when a physio, a spinal consultant think that it's going to change your management.
Okay, and you said before that on an MRI it normally shows up lots of things which might not be relevant. How does the doctor or consultant decide what bits are relevant and what bits aren't?
They will decide that in conjunction with your symptoms. So it will be very much dependent on what your symptoms are, whether you have leg pain, what makes your back pain worse, what makes your back pain better, and they'll be able to distinguish by asking you some questions that will give them a nice insight as to what is causing your pain. Okay.
All right, next one then. Will exercise make my back pain worse or cause more damage, and will rest not help?
No, so although it might seem like that initially when movement is sore to do when you have a bad back, actually the sooner we do get moving and the sooner we are able to return to our normal activities, the better. Our bodies are designed to be used, moved, muscles want to be worked, so the longer we avoid that for, the likelihood is that our back pain will get worse. So the sooner we can get you back moving and back to normal level of activity, the better.
I suppose it's about pacing the level that you return to and graduating it slowly so that you don't have a massive wham bam and load yourself too much.
Yeah.
Okay. Next question then we've got, I have a child, 3 years old. How can I control my pain with my child? I assume this may mean kind of lifting and things like that maybe, but.
Yeah, good question. So obviously with young children, they're quite unpredictable. So the bits that you can control are the things like how you lift your child. Again, bending and lifting isn't dangerous, so as long as it doesn't cause you pain, that's absolutely fine. And if you know that you're going to do certain activities and you've got certain things planned over the course of a week with your child, then it's looking at your week, pacing things. Don't plan everything on one day. You want to spread things out throughout the week. I can reassure you that bending and lifting is not harmful for your back. It might be that, you know, it's just a little bit sensitive to it at the moment, but some form of exercise and movement should get you back to where you want to be.
Okay, next question. How do I know if surgery is required?
So surgery will be discussed on a case-by-case basis, and surgery will be determined by your symptoms again. So whether there are any concerning features of your pain, whether the MRI indicates it. And again, that decision will be made by the consultant, but it will only be made if you have tried all conservative options and the symptoms that you're presenting with correlate with what is on an MRI scan and that surgery is indicated. If you haven't tried any conservative methods, then the consultant will normally ask you to go and try those conservative methods prior because of risks associated.
Good. Okay, and last question: is it better to use heat, ice, or both at the same time, or how do you know which one?
To be honest with you, there isn't a right or wrong. It's whichever you feel helps you more. Most people prefer heat because it's a lot more comfortable and a lot more pleasant, and that's absolutely fine. There is some people like to do something called contrast bathing, where you use heat for 10 minutes and then ice for 10 minutes. Again, that's absolutely fine. There isn't a right or wrong, or generally whatever feels better for you and whatever helps your pain.
Okay, good. Thank you very much, Becca. Those are all the questions that we have for you today. And that brings us to the end of our session today. But before you go, please can I ask that you do complete the patient feedback survey so we know what we've done well, what we can improve on next time, or any other areas that you'd like us to cover. Thanks again to our presenter, Becca, and I wish you well on your way. Thank you.